A new outbreak has been reported in Greater Vancouver, and Richmond is on alert for a 12-kilometer radius. Virus survives for months. First human case in the US. When will it end? Just when everyone thought the epidemic had gone away, the coronavirus kept attacking with various strains, and even Delta threatened to make a comeback. Influenza, Ebola, bird flu, hepatitis, measles, all in turn, with a vengeance to turn the human world upside down. Just as the WHO acknowledged the actual COVID-19 death toll of 15 million people and another increase in Ebola cases, another alert of an expanded new outbreak came out of Canada. First H5N1 infection in poultry in Metro Vancouver, with confirmed cases in the Chinese-populated city of Richmond. Health authorities issue an emergency notification. On Wednesday, May 4th, the Canadian Food Inspection Agency, CFIA, officially confirmed poultry have tested positive for the pathogenic H5N1 avian influenza virus in the Kelowna and Richmond, BC areas. This is the third and fourth flock of BC poultry to be infected with the bird flu virus in the local outbreak this year so far. The FDA notes that these cases of infection may have resulted from contact with infected migratory wild birds and reminds local small or backyard poultry owners to remain vigilant and take appropriate precautions immediately. At this stage, the premises where the avian flu virus was detected have all been quarantined and all producers within a 12 kilometers radius have been notified. Just today, the BC SPCA issued an official emergency notice asking everyone to temporarily remove bird feeders from their own backyards. In terms of available cases, flying birds such as ducks, geese, gulls, geese, owls and eagles are at the highest risk of contracting and transmitting avian influenza. The virus is highly contagious, can be transmitted through fecal and respiratory secretions, and can survive in the environment for months. Bird feeders in residents' backyards also have the potential to become sites for disease transmission and discourage people from attracting birds or other wildlife to congregate. This is a particularly dangerous source of disease. In North America, the H5N1 avian influenza virus is a federally controlled epidemic-level disease, and so far more than 250,000 animals have been killed across North America in an effort to stop the virus from spreading. Just last week, the CDC reported the first human case of bird flu. When it comes to the H5N1 avian influenza virus, the Chinese people should not be unfamiliar with it. The virus is primarily transmitted among birds, with the next most common case being infection in pigs, and the H5N1 avian influenza virus is highly species-specific, although infection of other mammals cannot be ruled out. That is, it can be transmitted to humans. Interpersonal transmission of the H5N1 avian influenza virus, which is also one of the zoonotic influenza viruses, is generally rare but not impossible. There have been outbreaks of avian influenza in Asia that have killed many humans. Health authorities remind everyone that while people who have no, or less frequent, contact with birds on a regular basis are at low risk of infection, they also need to be aware of the environment. The main route of human infection with the H5N1 avian influenza virus is through direct contact with infected animals or contaminated environments. Early symptoms are fever, cough, and sputum, which can rapidly progress to severe pneumonia, sepsis with shock, acute respiratory distress syndrome, and even death in severe cases. The latest WHO report shows that, depending on the subtype of the virus, infected people may also develop varying degrees of conjunctivitis, gastrointestinal symptoms, encephalitis and other encephalopathies, so don't take it lightly. 3 weeks ago, an outbreak of avian influenza occurred in a commercial poultry producer in the BC North Okanagan. Subsequently, the virus was also found in a small backyard poultry flock in Kelowna, causing concern to the government and relevant disease control authorities. Between April 20th and 27th, people found 7 wild birds that died bizarrely and subsequently tested positive for the highly contagious H5 strain, including 3 snow geese and 1 Canada goose in the Vanderhoof area, 100 Mile House, Bowen Island, and bald eagles near Vancouver. With more cases expected as wild birds continue their summer migration north, The government says the BC government has ordered all commercial poultry operators with more than 100 birds to move them indoors until the end of the spring migration period in May. The Health Department will also continue to work closely with CFIA, BC poultry breeders and poultry farmers to ensure enhanced prevention and preparedness measures to protect the health and safety of poultry and residents. In everyday life, people can be well protected against the disease by the following measures. Eliminate or reduce the exposure of poultry to wild birds. Reducing human exposure to poultry. Intensify the cleaning and disinfection of all items, including clothing and footwear, when entering areas where poultry flocks are located. Avian influenza is quietly spreading in many parts of BC. Conventional influenza is back in people's lives. The coronavirus has not yet subsided, and the Department of Health is closely monitoring cases of unexplained pneumonia in children.